Good afternoon, everyone. I hope you are enjoying this great day, this beautiful day. I'm Sylvia Huang. I'm a licensed clinical psychologist. I'm so honored to join you today. And first of all, I want to start out, thank you for adopting me. Okay, I am, let me kind of switch to the next slide. So today I'm gonna talk to you about psychosocial oncology, counseling, and cultural sensitivity, two big topics. And I'm gonna do this in a whirlwind kind of trip, so we will not only my goal is not to run through the slides, but to introduce you to this emerging field of psychosocial oncology to you all. And I love my work, working with cancer patients and families, their loved ones, and also as all the mental health professionals and also interdisciplinary professionals. So let's kick off this module. So a little bit about myself. So if you listen to me, I have an accent. I'm not originally from here. I make grammatical errors here and there, and so please bear with me. And my Chinese name is Chao-Hui, and in translation, it's kind of translated into trillions of wisdom. As you can see, my parents have very high expectations of me. And that's why I personally choose to go by Sylvia. I named my middle name myself. So I can be free from expectations. I can be myself. And to mention trillions of wisdom, I do not have. But I do know that I always learn from everyone. Most importantly, from the patients, from the families we have the most privilege to work with. And I think being in Birmingham, also online audience, hi, how are you? Maybe you are spreading out from every part of the globe. I wanted to say hi because I think here in Birmingham, Alabama, I get to meet the most diverse patient population and healthcare professionals and many, many talents here with all backgrounds, all genders, all races, all minority status. So I'm very, very honored to be here to talk to you about. I think that's the fusion of my love, both psycho-oncology and also cultural sensitivity. I do not have any conflicts of interest to disclose. And today we are gonna cover four things in about 30 minutes. So first thing, we are gonna introducing the emerging field of psychosocial oncology to you all. And secondly, we're gonna talk about integrating psychosocial oncology with professional counseling or mental health services into your routine practice as a subspecialty competency. And the third, I would say, bullet points will be applying culturally sensitive strategies to support your patients and loved ones in your practice. And number four is identifying training opportunities further down the road if you've cultivated interest in advancing your skills and knowledge in this area. So Psycho-Oncology 101. So what is psychosocial oncology to begin with? So it is the study of the psychosocial aspects of cancer across the cancer care continuum, even from before the diagnosis, even from prevention, because we know that cancer a lot of times starts with what? With screening, right? So if we can promote screening up front, that will be helpful. So from prevention to cure. And also it's a subspecialty of cancer care that dealing with two psychological or psychosocial domains. One is psychosocial reactions of patients with cancers and their families and healthcare providers when they receive a diagnosis, when they go through treatments, all the psychosocial reactions associated with that process, and also the behavioral factors, all the factors that contributing to cancer risk detection and survival. So that's pretty broad, right? And then I would say a bit history. Like, I don't know, here, I know I have met a few colleagues here, very wonderful. How many of you have heard this term called psychosocial oncology or psycho-oncology? Would you please raise your hand, please? 1, 2, 3, 4, 5, a few of our audience. And to be honest with you, I went through grad school, I went through doctoral training, and it was really in my doctoral training late years, I learned about, oh, there's a term called psychosocial oncology. I have never heard this term. What is this all about? And because we know oncology, we all know no innovative or states of the art cancer treatments. But what is psychosocial oncology is all about? So back in the 1970s, that's where it all started. It's approximately around my age. Okay, I'm gonna turn 50 this year, so this is something kind of I grew up with, but did not know that. But it's here is a picture of Dr. Jimmy Holland. She's a psychiatrist and married to an oncologist. And when she listened to her husband talking about the patients, she was extremely puzzled by the fact that they only talk about the physical aspect of cancer, the treatment, but it's rarely mentioned the psychological suffering or the anxiety, the distress, the relational change, and the role change associated with cancer. It's like she was like very puzzled, and she determined to make a positive difference. So over the past 50 years, I wanted to shout out to her because of her work. It really is a we call clinical practice transformation in the field of oncology. So it's no longer only focused on the physical aspect of cancer. It's broadened. As you see the definition here, I would say that early research highlights probably more around emotional distress or depression, anxiety, and other psychosocial challenges faced by cancer. However, the more they realize that, the more they see this as holistic, comprehensive cancer care. It should be part of day one cancer care provided to all cancer patients and their loved ones from the very beginning. It shouldn't wait until crisis come up, because in my therapy room, what happens is that when I sit down with my clients, guess what? They got referred to us, they are already in crisis, or they already have been suffering and struggling on their own without appropriate mental health interventions up front. So when they come to us, it's usually they're already traumatized, or they are relieving some traumatization reactions throughout the cancer journey, or the relationship has changed so much and they feel abandoned or betrayed or very hurt by the relational change due to cancer. So just so you know that it's very important to have this field integrated into all cancer care practices, and also especially importantly with mental health professionals kind of competencies. So one great advance in this field is that the introduction of support care programs within the cancer services across the nation. So support care service is the additional layer of support for cancer patients and their loved ones throughout their cancer journey, from the time of diagnosis through active treatments, through survivorship, and also even beyond treatment, because I know a lot of times research data has shown that cancer patients actually struggle the most at several pivotal milestones across their cancer journey. One is, of course, receiving diagnosis. Many of our patients recall that as a very traumatic reaction. Sometimes people receive a call late Friday afternoons. Okay, you got cancer, just a call. There's no further detailed information, and kind of leave them high and dry. So I have a 30-year-old young female with two young kids, and kind of always healthy, jogging and doing her best, and is on the rise of her professional development. And she received such a diagnosis on a late Friday afternoon, and that opens almost like a Pandora box of a lot of psychological reactions immediately after. So just so you know that so the introduction of support care services is that we consider to provide a holistic interdisciplinary support to all cancer patients, addressing all areas, not only psychosocial cancer care, but what about nutrition? What about physical therapy? What about exercise physiology? What about other aspects, financial counseling that's needed to support cancer care? So psycho-oncology, although you see it's psycho-oncology, but if we define it more broadly, it's psychosocial, spiritual, cultural, even digital oncology. Every aspect, not generally kind of just kind of outlined in the physical aspect of cancer care can be addressed here. So as I mentioned, psycho-oncology or psychosocial oncology has been recognized as a core component of comprehensive cancer care. And there are a couple of I would say, international or national societies established to support this work. So you'd be surprised, like who will be the members of this institution, like American Psychosocial Oncology Society or International Psychosocial Oncology Society. It's actually physicians, nurses, social workers, even PTs, even pharmacists, of course, counselors, psychologists, psychiatrists, everyone. It's everyone. Why is that? Why is that? Because there's no health without mental health. Okay, so every provider as a frontline, even for our front desk people, they can detect the emotion when patient show up with distress and all that, with anxiety. You recognize that. If everyone has this training or has this recognition of how important we can support our patients' mental health and their loved ones' mental health across the cancer care continuum, that will truly make a difference. So I'm very grateful for all this societies that have been established, and there's a journal called Psycho-Oncology Journal, already published a lot of randomized controlled trial studies to show evidence-based interventions in our field. So a little background of the International Psycho-Oncology Society. I went to Dr. Jimmy Holland's memorial service. She was not only the founding mother of this field, she grew this field and cultivate this field into the globe. So in one of her kind of memorial services, kind of, I would say people come up and talk. One of those is from Africa. And I am so grateful to see there's an Africa Psychosocial Oncology Society being established there to support the cancer patients and loved ones right there in Africa. So, and Dr. Jimmy Holland will bring this the trainees, the co-workers from Africa to her home, house them in New York, so they can access more training resources and bring back. So I wanted to share with you because I am also empowered by love and passion and the need to say that this is very important and let's do this work together. So just wanted to very quickly show you the prevalence rates of depression, anxiety, and PTSD. I'm going to use a lot of breast cancer examples simply because we have a grant funded through Women's Breast Health Fund, and then we were able to establish a training curriculum to focus on breast cancer survivors and their loved ones. But however, the principles I talk about here is highly applicable to all types of cancer. We probably can, and the statistics are pretty similar across the board. And if we use breast cancer as an example, as you can see, the global prevalence of depression is one of three patients already can experience depression. Anxiety is even higher, which is very common. A lot of anxiety and also PTSD. A lot of times people do not realize how cancer can be such a traumatic event. It may not be the full-blown PTSD, as you can see in the statistic here. Probably only 4% or less than 10% meet the full diagnostic criteria. However, I would say among more than 80% among the newly diagnosed, and also for long-term survivors, you can see continue to experience long-term symptoms. And a lot of times they went through the re-traumatization process. Anticipatory worry triggers the next cycle of re-traumatization and medical mistrust, etc. So it's a lot of issues associated with living with cancer. So very quickly, there are a lot of clinical presentations that, like, of course, here, I think we have a lot of mental health professionals, so you can recognize all the symptoms, but you probably can see that there are some commonalities alongside with a cancer diagnosis, especially around sleep difficulties, fatigue, and also I would say concentration difficulties. And when we are struggling with low energy or kind of unable to do what we love to do, guess what? We feel less empowered. We feel less I would say, like ourselves, and we are not function or performing like ourselves, guess what? We feel low, down, depressed, anxious. And so it's a lot of things going on. And of let alone a lot of treatment side effects like chemobrain that can impact one's decision-making capacity and day-to-day functioning. So with that said, I wanted to propose psychosocial oncology as part of trauma-informed therapy. Many of the patients I have the privilege to work with, they come to us sitting down. It's not only the cancer as the most prevalent things. They carry the package with them. A lot of them are the only provider in their family, especially I would say a lot of dear and near African American ladies I have the privilege to work with. And one of the patients I just talked to yesterday, she was very tearful, and she said that cancer taught me one thing. I've been there for everybody, but when I need someone, I look around, I'm not quite sure. Okay, my family has been kind of looking up to me and I'm doing everything for them. But when I need someone, I look around, I'm not quite sure they're gonna be here for me. Okay, and a lot of times after cancer, relation change immediately. Sometimes people will say some nice word. Okay, you can beat it, like we call some very encouraging words, but some of our survivors also has have taught us something very important. Just be very aware of what we call toxic positivity. Just focusing on, oh yes, you can beat it, because this way we do not allow the space for them to process the thoughts and feelings. A lot of sadness, a lot of changes, a lot of financial distresses. I have one young breast cancer patient right now. She is really struggling because she got diagnosed just in February and then was told in June that was diagnosed with stage 1, and in June all of a sudden people tell her you are stage 4, and a week later, oh no, we got it wrong, so it's stage 2. And you can think about the emotional roller coaster for her to go through all that. And she was like, I was hoping to pursue fertility preservation treatment because I really want to have another baby. However, guess what? I don't have enough money. I am already receiving so many bills, and they bill me for this, for that, and I can't tell what is for which is for what. I already so scared. I don't know if I have enough resources to go through all the cancer treatments. So you can imagine the stress associated with that. So we highly kind of recommend that all cancer care should be trauma-informed care to realize the impact of their past, their present, even the future challenges they may be encountering. And I listed here because I do know that today's topic is very important, right? Mental health equity. And we know in many ways, minority population in many ways already endure a lot of stresses, accumulated stresses, even from day one, even from the community. Many of my patients told me that I feel not safe for my son to go out there, okay? Or it's a lot of, I would say, stress associated with systematic discrimination or violent sudden death, and let alone COVID, which really impact all of us. I think our society as a whole has not realized the impact yet. We're still kind of living through this. I'm very grateful we are all here at Max, right? But even a year ago, 2 years ago, we are not there. And we have experienced more than 1 million deaths since COVID happened. And as a society as a whole, we haven't really grieved properly. You think about 911, people grieve, not only here, but globally grieve alongside with the US. But here we haven't really grieved. We are still kind of, and as mental health professionals, we are gonna help our patients, even our families, or even ourselves to go through we call it the mental health epidemic. Okay, it's the kind of long-term side effect. And can you imagine during COVID, without proper access to healthcare, a lot of delayed scans, a lot of delayed surgeries, and the fear of going out and with impressed immune system, afraid to go out and meet others, and that kind of isolation, that really impact many of our cancer survivors and their loved ones. So really wanted to highlight the importance of that. And of course, traumatic relationship. There's one saying that cancer manifests everything. It's good. It's probably gonna be further strengths, and we do see cancer bring families together, friends together, communities together. And we also see that sometimes the come together thing happens in the very beginning. And after a while, guess what? People don't know what to do or what to say and kind of faded away. And that we deal with that a lot to help our survivors to advocate for themselves, to teach their loved ones, help others help themselves, to understand there's actually long-term consequences, the emotional consequences of cancer. It's just not one time or at the time you finish your active treatment. It's a lot going on. So very fast, many of you may have heard this term, may not have heard this term, but if you have a family member who is diagnosed with cancer, who needs to go through routine scans, whether it's PET scan, CT scan, all that, a lot of them are going through this anxiety, special type of anxiety called scanxiety. It's very real and it's very crippling. We have patients to a degree that they would even cancel or postpone their NRI because they were traumatized while sitting there, cannot move in the MRI machine. Or when they go through radiation, they were told you cannot move because the radiation may not shoot to the right spot, targeting your tumor. So it's a lot of stress. So as mental health professionals, we can see that the timing of anxiety can be before scan, during a scan, even while waiting for results. And waiting again is no fun. Okay, we have patients waiting for weeks to learn about, okay, what's my fate, almost like what's my next steps, and a lot of uncertainties. And sometimes a scan is scheduled in between 3 months to help them understand what's my next step. And can you imagine the stress associated with that? Also the night before, or just sitting in the waiting room trying to learn about that. I have a colleague who is very near to me, and one day I got a call from her. It's all kind of sobbing, unstoppable sobbing. And I what's going on? She said, I'm sitting in the exam room waiting. They just told me that I have to be rescanned again. And it's just the thought, like even have the possibility of being diagnosed with cancer already terrified her. And so just so you know that this is very profound. So also wanted to highlight the importance in just kind of in line with today's very important topic. There is definitely a lot of cancer mental health disparities and health disparities as whole. And whether it's, I would say, lack of access to healthcare due to, I would say, socioeconomic status or insurance barriers. We have a lot of that, right? And also, so just so you know that the breast cancer incidence rates among white and Black and white women, although are close to begin with, but Black women have a 40% higher death rate from breast cancer, and that's significant health disparities there. Why is that? That shouldn't be happening, especially this is 2023, but this is very recent data. This is not something old. And I do see like the trajectory is different. Like sometimes it's like, it's either delayed diagnosis or after diagnosis not connected to treatments right away, or there's some delay in between, or being dismissed of like, okay, I have concerns, I think there's something going on, but I would say the request was dismissed. And I recently, a few months ago, I have a heartbreaking example of that. It's not treated here at UAB, but a patient from elsewhere being dismissed of her concerns. I think something's going on, help me. And the treatment they gave her turned out to be probably not the evidence-based treatment targeting her type of cancer. So she got delayed, and when she came to UAB, it's already stage 4. So and that shouldn't happen. And I would say that and also young women have a higher incidence of aggressive cancers among young Black women. So just so you know that there are still consistent health disparities, and also I would say because of that, mental health disparities, access to care. So here, in terms of time and everything, I wanted to say that aggressive efforts needs to be in place to eliminate health disparities in cancer, from early detection, from patient education, patient engagement, advocacy, support care across the cancer journey. And I would say that all of us, each one of you sitting at the table, yes, at the table, have a role to help eliminate health disparities in this field, and because it's relevant to every one of us. I know that very few of us have heard about this term psycho-oncology probably until today. However, how many of you have met or know someone who is diagnosed with cancer or live with cancer or impacted by cancer? Yeah, I would say probably 99%. And we are not alone on this journey, so we can together can make a difference. I do know that we still have a few minutes, so I'm gonna introduce you to some resources very quickly. So UAB, here at UAB, we are very, very grateful, extremely grateful, because in the past couple of years, we launched the psycho-oncology program here at UAB. So we specialize in assessing and treating psychosocial symptoms and care needs related to cancer. And we are open to all cancer types, and not only for patients, but also for their caregivers. Because when patients come to us, guess what? I usually put it this way in our initial session, like you and your family sitting in this rocking boat in this big ocean together, rocking up and down. Everybody feels busy, dizzy, and overwhelmed. And how can we support you all? How can we partner you all? And because guess what? In terms of cultural sensitivity, as a kind of an outsider, I understand that I'm learning every single day in terms of cultural sensitivity. I would say probably boil it down to the very basic: listen and learn and ask. Okay, and I treat my patients with the highest, I would say, respect. They are teaching us. So just so you know that that's our philosophy, that's our beliefs. So we definitely implement a lot of, I would say, system-wide efforts through our health system, including system-wide distress and depression screening. And I'll be happy to talk to you more about that, how important that is. As you know, if we go to see a doctor, we go through all the vital signs, right? High weight, high blood pressure. What is the mental health vital sign? Is there any mental health vital sign being integrated into the routine care? No. In the past, no. If you go to your primary care doctor, probably right now they're asking you some depression questions. And if primary care is asking that, how important it is for oncology, this is a serious illness group, to ask this question. So here at UAB, we were able to go through that, and it took us 3-4 years, and we were able to train many frontline nurses, CMAs, clinical medical assistants, to partner with us, because there will never be enough mental health professionals to do this work. So if we partner with frontline staff to do this work, guess what? They do early detection, and they can refer to us. And our team, we will do follow assessment, and we will provide intervention, evidence-based intervention, and we will connect them with community resources. So with that said, our annual screening volume is already over 45,000 last year. So which means that we routinely screen cancer patients for their psychosocial distress. If they kind of meet a cutoff, we connect them immediately with our program for resources. And all the resources are free as part of their comprehensive cancer care. So no insurance barriers, no caps, like how many sessions you can access to this. This should be available. So our service volume continued to increase from a few hundred visits. Right now, I would say this year we are going to pass 5,000, and that this is last year's data. And we have a team. And one of our previous team member here, Kaylee Curry, and she's amazing. And she was one of our psycho-oncology counseling residency program. She's one of our residents. And I wanted to shout out to her. So very quickly, just wanted to kind of end our discussion here, just so you know that this is just a picture. If you don't remember anything I talked today, this is how complex it is, okay, in terms of the psychological journey. And most oftentimes when we get a referral, you see the middle circle, depression, anxiety. It's way beyond that. There's so much going on beyond those two commonly observed symptoms. When a patient referred to us for depression, if we drill it down, okay, it's probably relational trauma or lack of access to care, etc. So with that said, I will send you all the slides so you can read through the rest. And very quickly, let me go through. Let me go ahead and do this way, probably quicker, because I do want to respect the time. And so, okay, here is a picture of us training staff, and we have been training more than 200 physicians and staff participating in partnering with Psycho-Oncology program. And also we create emotional first aid kit and depression screening and suicidal ideation handouts for our patients. And very quickly, I wanted to kind of show you there are definitely evidence-based psycho-oncological interventions already very well studied. And today we do not have time to talk about that. And for those who are interested in learning more about evidence-based interventions, we do have an opportunity to cover them in our, let me see if I can end the slideshow and quickly move to the slide deck like I wanted to show you very quickly. So wanted to share with you some training resources to begin with. For those who are interested in cultivating this as your additional tool set in your mental health practices, we do have resources available for you. It's called Psychosocial Oncology Training Academy, PODA. It's an interprofessional training program. You can earn CME-CEs. For everybody, you can earn up to 17 CME-CE, and if you are a counselor, you can earn up to 16. So we have been delivering all these workshops throughout the past few years, and then we have trained more than 400 providers in our region. So these are our partnering organizations. We have trained more than 45 organization participants to do this work. So very quickly, if you are interested, this is no shame kind of share resources with you, because this is something probably will transform how our community to build a support network for our cancer patients and their loved ones. So we do have training workshops available coming up in the fall, 4 half days throughout September to December. So if you're interested, feel free to go online, to go to our PODA website, World Wide Web, PODA or podatraining.org, and also our QR code here to learn more. So with that said, really we want to do is to improve access and quality of psychosocial care, cancer care across the board, not only here in the local greater Birmingham community, but also as a whole, really in the nation. We need a lot of mental health providers and also everyone to partner to make the lives easier and better supported throughout their cancer journey, regardless their stage, regardless their socioeconomic status, regardless their minority status. Even for minority population, I would say that we need to be very intentional, even provide more support, okay, to bridge the gaps of past disparities. So with that said, I wanted to thank you all very, very much. If you have any questions, feel free to shoot me an email. Just wanted to thank you all for putting and listening. Thank you.
Thank you so much. And for the clinicians in the room, I actually took the PODA training, and it was awesome and great. They were able to include survivors of cancer and then having conversations and being asked, able to ask them questions. So it was a really great training. So thank you so much for that. And thank you, UAB, for all you all do.
Thank you.
Yes, thank y'all. Okay, so we're not about to take a break. We're gonna keep going, y'all, okay? But y'all can go get a water break or a restroom break while Dr. Nadia says so.